Happy Friday 13th, everybody. Maturely Fit, Health and Wellness. This is Patrice Tomlin. Thanks so much for joining me today. Anyway, big shout out to you, and I hope you have a productive day and a wonderful weekend. First and foremost, I want to thank you for your calls, your messages on Skype and email. And I want to give a big shout out to the ladies that have been digging my haircut. Thank you so much. I love you all very much. And it is much appreciated, which is the segue here to the actual topic for the day. This is not a haircut. This is not something that I have done purposely. Now, my hair's been short since college, since eons ago, decades ago. It's never been this short. However, unfortunately, given chemotherapy treatments and the type of drugs that I was taking, or medications, I should say, that I was taking during my treatment, unfortunately, there are a lot of side effects that are still lingering. One of which is my hair, when it did grow back, it grew back patchy. And I can't be walking around with bald spots here and there. So you'll see the following pictures. Those pictures are my hair now, because I actually am recovering, of course, many of you know, from breast cancer. And with the chemotherapy treatments that I had, it kind of blew me out the water. So that is my 360 view of what my hair looks like now. And I very rarely put in a plug for anything, but the way that I manage my hair, and a lot of people ask me, the way that I manage it, I can only say the way that I try to manage it. It is not manageable at this point. Trust me, it's going everywhere. And I keep it leveled, and I try to keep it trimmed every couple of weeks, because when my hair grew back from chemo, it grew back in patches, but it never grew completely out. Now, my hair's been short since college, and that's been over 30 years ago. However, it's never been this short. But I try to manage it, and I try to maintain it by just, of course, I don't put any chemicals in my hair. I use Hawaiian silk moisturizer. That's all I do. I wet my hair in the morning and, spray the moisturizer in it, brush, and go and get on with the rest of my day. But you ladies that have paid me that compliment, I do appreciate it. I love you guys. And that's kind of the segue here for the topic of the day: what to expect after chemo, or to expect the unexpected. Put it that way. I don't know, honestly, in a nutshell. I'm just keeping it real with you. I can't tell you what to expect. No two people are alike. You may share the same DNA. You may share the same physical features. Everyone's body is their own. Your own journey is just that, your own journey. However, if you check us out at maturelyfit.com, click on blogs and look at some of the blogs that I have for you on cancer, and some of the helpful links that will allow you to go further into it on a technical and scientific level, because I try my best not to get too technical and not too scientific here, because I'm not trying to go there. I'm trying to make it as easy and simple to understand as humanly possible. Anyhow, depending on your cancer treatments, and this is for ladies and men, your body may not necessarily feel like your body after your chemotherapy treatments are over. Even though, now I've managed to, mine is currently in remission. Thank God. I was diagnosed with cancer last year, 2018, 3 days before my birthday. Shortly after Labor Day, I was in surgery on the operating table, having a portacath put in my chest to get ready for my chemotherapy treatments. So it just went so fast. I just didn't have time to blink. And so needless to say, I just drew and I put up an emotional wall. There was just nothing to think. I didn't know how to think. I didn't know what to do. I mean, it was like, hey, are you serious? You know, you're kidding me right now. And that's exactly what I told the doctor when he called. So, anyhow, I want you to expect a change. That's the best advice I can give you, because your life is never the same after you have dealt with and fought through a life-threatening illness. Cancer is scary as it is. We can all develop it. It does not discriminate on age, race, sexual orientation, nationality. Cancer is cancer. We all have the potential of developing it, whether we're born with a little of it that takes a couple of weeks or a couple of months or even a couple of years to come out into full fruition. We can develop cancer at any point in time in your life. Whether or not it's genetic or not is irrelevant. The easy way I can tell you this is cancer, again, check out my website, and that gets more specific, more technical, and more scientific with what it actually is and what it can do. Cancer are rogue cells, to put it simply. They're rogue cells, they're mutated cells that attack healthy tissue and cells and grow and spread. Ergo, you need treatment. Okay, that's all I can tell you. That's the easiest, quickest way I can explain it to you. And we all have the capability of developing it at any point, at any age, whether it's now the idea of you possibly developing it because it's genetic. Okay, that is possible. It is very, very possible, but it doesn't have to always be genetically produced. It's just something that's there. If you can, and you have an opportunity, although I did not, please try to be calm. If you know somebody that's dealing with cancer, if you have been diagnosed with cancer recently, don't panic. The cancer is big enough as it is, and it is very, very stressful. However, getting back to the topic, expect the unexpected. Once you've gone through your cancer treatments, irregardless of the stage of cancer, of the stage that the cancer is in when it's found and hopefully can be removed, at the point that it goes into remission, hopefully, that we're keeping the hope alive here, y'all. At the chance that it goes into remission, whenever it goes into remission, you got to keep in mind a couple of things. Number one, things will be different. Your life will change. It is not going to be the same. It changes the moment that you get the word that you've been diagnosed with cancer. And it changes physiologically, mentally, immediately. It's like, ooh, what? And emotionally, you may go through the breakdowns. That's why I'm saying your life will change. You won't see things differently. You won't see things the same. However, the automatic thing for people to do is panic and start to become negative. Negativity will not and does not help your situation. You have got to remain positive. It's not necessarily the cancer that you need to be concerned about in the long term, especially if it can be removed or if it goes into remission. It can be treated, whatever the situation is. What you need to be concerned about in the long run is your treatment. Your treatment everybody's different, so everybody's treatment is going to be different. You can expect things like maybe your hair falling out during treatment, especially for chemo patients. Men have that as well as women. But not everybody's hair falls out during chemotherapy treatment. Mine did almost instantly. And actually, I was getting ready for it, so I went ahead and shaved it all down in preparation because I freaked out. I didn't want to wake up one morning and see it laying on my pillow. However, when my hair grew back, it grew back like this. It hasn't grown completely out yet, and it's been months. And it may take a little longer. So I have to be patient, but I'm not worried about it. If worse come to worse and I get that desperate, I can put on a wig or a scarf or whatever. But the bottom line is that's one of the issues, the hair. The eyebrows, especially ladies, that's no big deal either. Use an eyebrow pencil until it comes out. Mine hasn't grown out as full as they used to be, but that's okay. They'll come back out. Use a pencil until they do. Hands and feet and legs possibly. Tingling sensations can happen also depending upon the medication that you've used or you've taken during your chemotherapy. That is very, very prominent among the taxane family. I took Paclitaxel. That is a Taxol drug. That is a taxane in the taxane family. If you can, by all means, check out what type of medication your doctor is prescribing for you during your treatment. If you start to notice too much tingling or discomfort in hands, like your fingertips and your feet and toes, please talk to your oncologist. Don't wait too long. Mine didn't develop until later in my treatment. Unfortunately, my oncologist that I had at the time, look, you heard me say at the time, I have him no more, did nothing about adjusting the meds. And at that point, it was a little too far gone. My neuropathy, which is CIPN, chemotherapy-induced peripheral neuropathy, which is nerve damage during chemotherapy treatments. Now, there are people that develop neuropathy too that also have diabetes or things like that, but we're talking about cancer. If you get that tingling sensation, if you have problems swallowing, if you have problems with your nasal passages, your tummy, you can't hold down certain things. You can't poop. Hey, I'm just telling you like it is. Can't poop without help. If your stomach is a little sensitive, milk of magnesium is the best thing that I personally have found to get it out without straining and taking a bunch of pills and taking it early in the day, waiting for it to hit before you go to bed at night. Okay, so milk of magnesium technically works within a couple of hours, and it works very well. Anyway, those are some of the things that you can expect. But aside from that, expect the unexpected. And again, when I say that, by you expecting the unexpected, anything can happen. Everybody's body is different. Everybody's capabilities of handling pain, stress, discomfort are different. If you have any further questions, please feel free to hit me up at maturelyfit@gmail.com. Check me out on the website. And of course, subscribe, like, share, and comment right here on our YouTube channel. I'm going to be back next week for more information. And hopefully I'll get an opportunity to answer some of those questions that keep coming in, but I'm trying to lump all the questions together that are pretty similar. So that's why I'm giving you the information that I'm giving you. So in any event, thanks so much for tuning in today. Peace to you guys. Have a great weekend.